most famous physical therapist on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, Bob, of
Brad,
course.
we got our new toy here, and today we're going to show you how to use the massage gun for carpal tunnel syndrome. You usually don't think of doing massage with carpal tunnel.
Right.
But we're going to show you some reasons why you might want to do it. So first off, I want to show you, these are all the muscles of the forearm, anterior forearm, the front here. And you may never have heard of this, but there's a thing called double crush syndrome. And this was, I'll talk about the two authors of this later, but they speculate that the nerve, the median nerve, which is the one that gives you carpal tunnel symptoms, actually gets a little sensitized by maybe being pinched up in the neck.
Sure.
Or you get a little pinched in the forearm,
Sure.
especially from the pronator teres. Here's the pronator teres, but this is actually the muscle right here.
It's right in here. So the idea that double crush means it's getting pinched in two locations, here and or here. I guess
that'd be a triple.
Yeah, right. But if it was here or here, whatever, it's two
double,
locations.
Right. And this isn't that common, but my theory is also it's just going to be good to massage all the muscles of the forearm because any one of them maybe could put a little pressure on the median nerve.
Right, because all the tendons from those muscles go right through the carpal tunnel.
Yeah, can you see that right here? So if you picture these muscles as they continue down, they enter, here's the flexor retinaculum.
Yep.
And that forms the tunnel, the top part of the and look at all the tendons that go through. I did a cross section here.
Perfect.
Yeah, look at all the tendons. There's 9 tendons there. This one I don't think is in the tunnel, but these 9 are in there. Flexor digitorum, superficialis, profundus.
Yeah.
So, but anyway, and there's the nerve right there. So we think by massaging all the muscles, you maybe put a little pressure, less pressure on the tendons.
Right, so those tendons aren't as taut and tight, so that it relaxes things.
And we're going to show you also, I think, Brad, that, if you hit the muscles up in the hand, in case the nerves are getting a little sensitive in there,
sure,
you might be able to take some pressure off of there.
It's one of those things, if you have a massage gun, it really works well, and it doesn't take that much time, and it typically feels good.
Right. And if it makes things worse, you wouldn't do it, but
exactly.
Generally it's going to make things better. So, all right, we'll move on to that. All right, so as we already demonstrated to you, we're going to try to massage the muscles in the front of the forearm. Upton and McComas, by the way, were the ones that came up with the research on double crush syndrome.
Okay.
And they feel like it's fairly prevalent. They felt like in 75% of the cases.
Oh, really?
It was present. So anyway, we're going to go ahead and well, this is probably a little bit too aggressive for that one. I'll take this one. That's the mother of all massage guns.
Yeah.
And now
this size or this size would work good.
Yep. And I'm going to use the ball.
Yep.
Because it's a nice span. It's not too aggressive.
Yep.
And I can work on it, and I'm going to hit that pronator teres, which comes off the inside elbow here.
So palm is up when you're doing this.
Yep, and let things relax.
Just be careful you don't get on the bone down here where the muscles connect, because that'll be painful. So stay on the muscle belly.
If you're worried about that, you could use the attachment, air attachment. We have one of those here? Yeah.
Oh,
here.
yes.
This right here. I can put it in this one.
Yep. So they're full of air, and they're nice and soft and spongy. It's a really good one around bony areas, or if you're just getting started and you don't want to get too aggressive.
Exactly. And these all have like 5 speeds. So you want to start the low speed. Determine your tolerance. I mean, you might the next day go up a little higher.
Yep.
But the first day, take it a little easy the first day because you want to make sure that you're not waking up in the middle of the night and swearing at Bob and Brad for going off.
We have a hard time sleeping when those vibes come through the
that's right.
airways.
Through the airways.
The internet.
So anyway, we're hitting all those muscles, and we also felt like, and again, this is a good one for the air, is to hit I like to hit the meaty pad thenar eminence right below the thumb.
Yep.
And I like to hit the other side too, even though that's not the median nerve. But I just like to hit the whole hand here.
Yeah, one thing you don't want to do is get over the median nerve where it crosses the
Right.
carpal tunnel, because that's going to beat it up, and we don't want that. It's pretty superficial. It's close to the
Yeah.
skin at that point. I've actually used this pointer one on the smaller gun, but I'm very particular about staying.
You're going sideways a little bit too, aren't you?
Yeah, and I'll get in there into that muscle and work it this way, just not on the carpal tunnel, and then over
The
here.
air-filled one really works well with this, Brad.
You
too.
like that?
Well,
Yeah.
feel it once. You know,
Yeah, it's definitely not near as aggressive.
Yeah, it's not as
and
aggressive.
it's spread out, so that's a great one to start with. I
Start
would not
with,
start
yeah.
with this one till you get a feel for where it feels good and where it works. Ooh.
Yeah, the thing that's nice about this too, with a massage gun, in my mind, is that quite often if you have carpal tunnel in one hand, you might also develop it in the other.
Sure.
So if you start massaging too much with the
Bare hand?
the bare hand, you might
yeah,
actually
if you're
start
doing it
develop-
manually.
Yeah.
Which there's nothing wrong with, but you do get tired pretty quick, and like you said,
Right.
you could end up with problems on both sides.
Now, Brad and I both agree that I don't think I'd buy a massage gun just for carpal tunnel syndrome.
No.
But if you're having, if you're getting up in a little bit of years like we are, things are going to crop up quite often. And massage gun, you can use it over the entire body.
Right. Yeah. If you're an active person, everyone we know that has them, including a ton of comments coming back, people purchasing these things are using them and happy with them.
Yeah. This video, by the way, is a part of a series of videos on massage. If you go to bobandbrad.com, go to the program section, look for the program on massage. We also have one on sciatica and hip pain, although we don't have a lot of
It's not up yet.
Yeah.
It's there, but it says right on there,
Tens.
it's coming soon.
Tens, shoulder.
Yep.
So anyway, go in there. Look, we have about, 30, 40 videos. Check out which ones pertain to you.
Right.
And you can watch that video. And then what else, Brad?
Well, afterwards, you can just click on the PDF printout, and you're going to get a preview or a review of the whole video, 1 or 2 pages long, all printed out. Bob's did a heck of a job with them. He should be an English major soon with this.
That's right.
And print it off. There's no cost to you whatsoever, not even an email. It's just strictly a gift for everyone out there to help themselves out.
So when you're swearing at us, remember we gave this to you for free. So, all right. Thanks for watching.